What does the NHS mean to you?
Healthcare free at the point of delivery, really, is the obvious answer.
Well, it's invaluable. It's something not unique to our country, but and at the moment it seems like it's its last days.
The NHS, it's a lifesaver, isn't it?
Healthcare is a fundamental human right, and I completely laud the NHS and what it's about. It's about providing the public with that, that common public good, and I think it's an absolutely incredible system. It's one thing that makes me really proud to be British and part of this country.
It's really good when you actually need it, at the point of, like, I only had to wait 4 weeks to see a specialist. I went to my doctor 5 weeks ago and I've got an appointment already.
When you use the NHS, are the choices available to you explained to you clearly?
Yeah, they explain it really clearly, and if I'm unsure, they would do obviously explain it so I can understand what they mean.
No, they weren't explained clearly, no. I've had an operation now and it's worse than what it was before. I wish I'd never had it done.
Not really, they just told me and then gave me a form of what medicine I need to get, and that actually made me have an allergic reaction, so it didn't really help me much at all.
Yeah, that was a good service, and I was I'm Polish, so I had a problem with my language before. They obviously provide me the translators and everything, so I can't say that wasn't bad.
I would say no. I don't think they are explained clearly.
I think it's there if you search it out, but I think it's difficult for people to interpret. I think it can be very intimidating how things are explained to people.
Do you feel the NHS does enough to involve you in decisions about your own care?
Yes.
Now you are, but previously you weren't. You were just told this is going to happen and that was it.
So
now they explain, and it's brilliant.
To be honest, I don't think it does, but then I don't think that's only the health sector that's suffering from a representative democratic deficit. I think all public service providers are. So maybe the government could do more to make us involved in our healthcare decisions and stuff.
No, I wouldn't think we are involved really. I haven't had the experience of being involved in anything the NHS do. I thought it's all done for me. End of.
People who are using the NHS, you need to speak to them more, but if you don't use it, you don't really need to know.
What's your experience of the NHS?
Yeah, very good. They're very helpful. Very, very good. Yeah, get lots of benefits. Myself and my husband, yeah.
My experience with the NHS, you had very long queues, basically. You obviously have to wait a very long time for everything you want from them, even for simple meeting with your GP or something, you obviously have to wait for weeks.
Yes, I had an operation 8 weeks ago. I came out, I had an infection in my shoulder, I had an operation, infection in my neck, and got pneumonia.
We'll hear from the NHS asking what you think of the service.
No, nothing at all.
I would have to say no. We get some information occasionally through the door about perhaps local NHS services. But in terms of feedback and requesting feedback from me, no. I can't say I've ever been engaged by the NHS in any way.
Yeah, well, I was in hospital a few months ago, and they gave us a questionnaire, about the food and the service and the health, the staff.
Not very often, actually. I can't remember any time I've been asked a questionnaire or asked my opinion on it.
Whose job is it to keep you well?
My own.
Well, yourself really, because you've got to eat the right food. Like your motor car, if you put rubbish and drive it wrong, then you're going to have problems.
The doctors in the hospital, the nurses.
What about you?
Well, I don't look after myself like I should. I eat all the wrong foods. I don't smoke, I don't drink, so that's one bonus.
It's up to us. You get enough sort of warnings and there's enough ill health, and I think sometimes if you just go and ignore it, like my husband had a massive heart attack. He's never one for taking tablets, but he knows it's up to him to take those tablets if he wants to keep on an even keel. So yes, I think it is up to an individual, to sort of help yourself.
Well, I've got to try myself I've got to work on myself and eat properly and see to it. The doctors can't do it. We have to do it. I've got to do it myself.
I think a lot of illnesses and that are brought on by people of their own doing, really. But I think It's important that I keep myself well, but I also would like a better GP service, I think.